So, welcome to FutureLearnAsks. This is a session where we FutureLearn staff get together with educators to discuss topics that we are passionate about. Today, our topic is coronavirus, and we're joined with the educator from London School of Hygiene and Tropical Medicine, and is an educator on the course Disease Outbreaks in Low and Middle Income Countries. So we're going to be talking about the course and about coronavirus today. So let's start with introductions. Hi, Jimmy. Lovely to see you today. Could you tell us a little bit about your work and your experience?
Sure. Hi, Danielle. I'm a professor of international public health and a clinician by background, and I've been working on infectious diseases since the 1980s. A lot of that time I was actually living and working in Africa, in particular in the Gambia, Sierra Leone and Uganda, and came across quite a number of outbreaks during my time. The first outbreak I was involved with was one of anthrax in the Gambia in 1983, and perhaps the biggest I've ever been involved with was the West African Ebola outbreak when I was in Sierra Leone in 2016.
Oh, wow. And could you tell us a bit about your capacity working with those cases? How did you help out on those?
Sure. In the early days, I was very much hands-on in the Gambia with the anthrax outbreak as part of the district medical team. Over time, I've become more interested in the research elements of outbreaks, so either conducting research or overseeing other groups doing that research. So my role has changed over the years.
Excellent. So we mentioned that you're an educator on the course Disease Outbreaks in Low and Middle Income Countries. Could you tell us a little bit about the course and what learners can expect to find out?
Sure. So the course focuses on outbreaks and in low resource settings, and we cover the wide-ranging impact that outbreaks can have, how to prepare for them, and the multidisciplinary nature of the teams that are needed to control them. We go on to talk about how the responses to outbreaks get triggered and how that's coordinated and funded. Later on in the course, we discuss some of the new and continuing challenges that outbreaks cause to us and what lessons we have learned for the future.
And considering, you know, what's going on in the media and the news, coronavirus, COVID-19 is a big topic today. Do you think there's some useful tips and bits of information that learners could find out and relate to what's going on today?
Well, I would hope so. We devised the course before the coronavirus struck, but what we do is we present a framework for how you think about outbreaks in general and how you would go about controlling them. Coronavirus is spread by the respiratory route, and so the public health measures that we would use to control that will be the same as for any respiratory virus and how that is spread. So yes, I think we provide a useful framework for any outbreak that occurs.
Excellent. Okay, so we're going to jump straight into the questions now. Question one, as an expert and someone who's worked in this field and done research in this field, what are disease outbreaks?
An outbreak is really defined as there being more cases of something occurring in a specific place than you would expect. So it can be quite small. So, for example, if you got one case of plague occurring somewhere where you normally don't see it at all, you could consider that to be an outbreak. But in many other cases, for things like influenza or for measles, getting above a certain threshold would make you think this is an outbreak and we need special measures to control it.
Okay, and could you discuss briefly the history of disease outbreaks and what that looks like in comparison to today?
The human population has always been exposed to outbreaks, and from reading history and even looking at our genetic code, you can see that we have been exposed throughout our history to outbreaks. They can occur anywhere in the world. They're unpredictable, so we can't know when a specific outbreak is going to occur. We are much better at being able to detect them these days than we used to. So I think we get the impression that there are more outbreaks than there were in the past, but it might actually simply be that we're better at identifying them when they occur.
Interesting. And so could you explain to us why coronavirus is causing an outbreak?
Yes, I'll do my best. This looks as though it was a spillover event from animals into the human population, which occurred in central China, and it then rapidly spread among the human population. Now, this is a novel virus. We've not seen it in the human population before, so there is no immunity to it, and it's clearly highly transmissible. We think that on average, every infected person will infect another 2 to 3 other people without measures being put in place, which means it can spread very rapidly.
Wow.
And then because it occurred in a city, that means that there's a lot of people close by who can be infected. And then because of modern transport methods, either within China or by international air travel, that means that it's been able to spread throughout China and now throughout much of the world.
Wow. And so you mentioned there that they spilled over from animals. This virus has spilled over from animals. Do you have any kind of suspicions what animals it could have come from?
Yes, I do. We think this probably came from bats to start with. We know bats carry a lot of different coronaviruses, many of which have never been seen in the human population. We're not sure whether it passed directly from bats into humans or whether maybe the bats managed to infect another mammal and it was that other mammal that then infected humans. And it's important that we find that out, because if there is continuing spillover from animals into humans, we need to be able to identify and stop that, because that could just cause the outbreak to continue. I think it's worth pointing out that most outbreaks are caused by animal to human transmission in the first place. Some 70% of new outbreaks are what we call zoonoses, which means that they're shared between animals and humans.
Wow. Very useful information there, stuff that I never knew before. I wanted to find out if you could kind of give us a little bit of a difference between a pandemic and an outbreak.
Okay, a pandemic is really an expanded, extended epidemic. What it means is that we have active transmission occurring in multiple areas of the world. It's not a sort of official definition that WHO, World Health Organization, would use, but it helps us recognize that this is a generalized epidemic, if you like.
Wow, thank you. So moving on to question 2 there. And audience, if you have any questions for Jimmy throughout this process, please do type in the comments below and we'll show them on the screen and try and answer those questions. But moving on to question 2, what causes a disease outbreak and why are some locations more at risk?
There's a number of common causes of outbreaks. For example, cholera, which is spread by the fecal-oral route, is a good example, or dengue, which is transmitted between person and person by mosquitoes, influenza, which is a respiratory virus and spreads by that route, just like coronavirus does. And then there's a category of outbreak-prone diseases, things like measles or yellow fever, that can be prevented by vaccination. And because of vaccines, that means we don't tend to see those anymore.
Okay. And what are some common causes of disease outbreaks? So you mentioned that coronavirus was spread from animals. And so is that the case for all of them? Are there any other causes or potential spread factors with disease outbreaks overall?
Yeah, there's a number of different ways in which outbreaks can spread. If they get into cities, urbanization is a good way for outbreaks to spread because you've got a lot of people, often very close together. And if you've got poverty or malnutrition or poor sanitation, then that can allow an outbreak to spread very fast. We've talked a bit about international travel, and even local travel can be important for moving outbreaks to other vulnerable areas. Where people are living very close with other animals, particularly say in backyard farming, then that's a good opportunity for pathogens to be shared between the humans and the animals. So that's another important way in which it can spread.
Mm-hmm.
And then things like humanitarian crises and wars are good ways for outbreaks to spread, because you have a breakdown in public health services, you often have large numbers of people moving around, and those are perfect conditions for epidemics to occur.
Wow, so those are the reasons why where you are can kind of really play a factor.
It can, yes. And one other example would be in tropical areas where you've got the right climatic conditions for insect vectors, mosquitoes and fleas and the like to actually survive, that you then find the populations are vulnerable to vector-borne diseases.
Interesting. So we spoke about how coronavirus was spread by animals. How do you suspect it was spread? How from the animals, from these bats potentially, could it have spread to humans?
I think that we feel that it's actually the close contact with animals that allows the transmission to occur. We see this regularly with influenza. When this occurs, that there's a sort of recombination event that occurs. It involves birds usually, often pigs, and then gets into humans. And again, it's that close proximity of humans and animals that is the real driver for this to occur.
Okay, so moving on to question 3, you mentioned that, you know, location factors could play a really big part, and part of that could be to do with public health services and public health care. Thinking of public health services, how can we prevent the spread of disease, and what is the role of the government, do you feel, in this?
Well, governments have the responsibility for protecting the health of the citizens in their country, and that applies for outbreaks as well. Sometimes, if the outbreak is severe, then international help is required to be able to control that outbreak, because infectious diseases don't recognize international borders, and we're all vulnerable to an outbreak occurring in any one country. In addition to governments, then healthcare workers of all sorts, and indeed providers of medical equipment, all have their part to play in being able to control outbreaks. And the general public, the community, also are a really important element of this. They're central to be able to respond to an outbreak. Without the community's involvement and engagement, it's not really possible to control outbreaks at all. And whether that is helping to design the intervention strategies that we use, or simply to listen to advice on how best people can protect themselves, we've all got a role to play in controlling outbreaks.
Thank you. So what would be your top tips for kind of dealing with coronavirus today? We've seen in the news that There are currently around over 80,000 cases of coronavirus. What can us as individuals do to protect ourselves and protect others?
Sure, I think that's a really important question at the moment. So what I would say is try to avoid crowds and crowded places. Not always easy, I know. Do try to avoid people who've got acute respiratory infections, whether they're people at work, people at home, or that you see on public transport, for example. Also avoid unprotected contact with animals, particularly with livestock and wild animals. Practice what we call cough etiquette yourself and ensure that those around you do it. And what that means is making sure that if you are going to cough and splutter, that you do it into a tissue that then can be safely binned, or if you don't have a tissue with you, perhaps into your elbow, but certainly not spluttering over people who are around you. And then I think really important is hand hygiene. We know that this can spread from contaminated surfaces, so regularly washing your hands. Best is soap and water, but if you haven't got those, hand gel is a really good way to stop this from spreading as well. And I think if you are ill with a respiratory illness and you might have had contact in some way with the coronavirus, then to self-isolate yourself at home and to let the health authorities know about your situation is also a responsible thing to do, rather than turning up at a primary healthcare facility or a hospital.
I like that kind of self-isolate kit. It's kind of better safe than sorry almost. Like if you think or if you suspect you have any of these symptoms, better to kind of stay away and before you come in contact with other people. Would that be your advice?
Yes, I think it is, because we know that it spreads rapidly and easily between people. And so the more that you can be isolated from the general public, the better it's going to be to slow down the spread of this virus.
Excellent. Thank you so much, Jimmy. I think we've got a lot of useful information there about, disease in general, outbreaks, and what this means in terms of coronavirus. We've had quite a few interesting comments from the audience. Thank you for your comments, everyone. And if you do have any questions there, remember to type them down in the comment box below. But I just wanted to see if we could kind of address some of them now or see what your thoughts were. We had a question from Sophie Rowlands, and she's asking, what do you predict will happen over the coming months with COVID-19?
Okay, well, that's the big question everybody wants to know. And I think the honest answer is it's really difficult to predict what is happening. From my colleagues who do mathematical modelling, we think that the really stringent public health measures that have been put in place in China have been effective, and they have actually stopped a lot of transmission that is occurring. So from what I mentioned earlier, that each infected person on average infecting 2 to 3 people, it's more like one infected person is infecting one other infected person now in China, which means that we're slowing the spread and we're reaching a sort of steady state. Now, that's encouraging, and it means that public health authorities in other countries can take some confidence that if they also apply really strong public health measures here, we may be able to stop this from spreading rapidly. And so, for example, the sorts of things that we're seeing in South Korea or in Italy, where there is a reduction in freedom of movement and so on, may be very effective in preventing this from transmitting. So I think we're still in a situation where we are looking to control this outbreak from spreading widely around the world. There are some countries which have weaker health systems and surveillance systems than others, and those are ones that we really have to watch very closely. places in sub-Saharan Africa or some parts of Asia in particular might be at risk of simply not being able to recognize and control this, and we must help them to be able to do that. So I think at the moment we are still in a situation where we are hoping that we will be able to control this. But we're on the cusp of this becoming generalized. And if that happens, then we may need to go much more into a mitigation stage where what we're looking to do is to slow transmission as much as we can so that we don't get huge peaks. And that means we're trying to protect the general public from being infected and also targeting our resources on those who really need it because they're seriously ill.
Thank you, Jimmy. And thank you, Sophie, for your question. We've had another question here that I thought was interesting. This one from Emma Jane Neal. So she's mentioned there's a hotel on lockdown in Tenerife as an Italian doctor has tested positive in that hotel. With air conditioning systems, is this not going to spread the virus further? Or could it? Is something to be concerned about when it comes to coronavirus?
Yeah, that's an interesting question. And I don't think we know enough at the moment about quite how the coronavirus is spread. We think it's, as I mentioned, by droplets, close contact, and contaminated surfaces. And if that's the case, and it's not spread by aerosol route, then air conditioning shouldn't matter. It's a question of making sure that individual people in the hotel are not coming into close contact with people who might be transmitting it. So I think at the moment that is a good public health policy that they're following in Tenerife. Okay.
Thank you, Emma, for your question. Toby Wright has asked, due to the fact that according to the BBC, the mortality rate is only about 1% to 2%, is there more panic being spread by the media than there actually needs to be about coronavirus?
Thank you, Toby. I think it is important to try to get this into perspective. We know that something like 80% of people who get infected by this virus, it's mild and they make a quick recovery. And that's good to know, and it's important for people to recognize that fact. But that means that we've still got quite a sizable minority of people who do get severe disease. And we think that it's the more elderly or those who have other health conditions who are more badly affected by this. Now, if, say, 15–20% of the population who get infected get severe disease, they're going to need to go into hospital. That's going to put strain on the health facilities that we have there. And so we do need to make sure we do have the ability to be able to manage those people safely. So it's a mixed picture. Not everybody who is going to get this is going to die or become seriously ill by any means, but there's a sizable proportion who will. And those who do get severe disease, it seems to be usually quite a prolonged illness. And on average, people who are hospitalized in the hospital for something like 10 to 14 days. And of course, that means that they are taking up a hospital bed.
Thank you. Thank you so much for that. And thank you, Toby, for the question. Abina has asked an interesting question. You mentioned that some locations could be more at risk. I mean, you mentioned potentially sub-Saharan Africa could be more at risk. Do you think there's any onus on the international community? Do you know if they've got any plans, or should they, to be prepared for this?
Yeah, that's a very good question. There are measures in place and they're being enacted very rapidly at the moment. So the sorts of things that are happening are that international experts have been to a large number of sub-Saharan African countries and have been advising on preparedness plans, what to do in terms of ports of entry and best measures of being able to clinically manage any patients who are identified. Of course, to do this, you need to be able to diagnose the infection in the first place. And we're seeing a rapid increase in the number of laboratories in Africa that are able to diagnose this. It's gone up from just 2 a month ago to something like 20 to 30 that are now able to make the diagnosis. The African Union has acted and is ensuring that there is good coordination between different countries so that we don't have different policies for travel and ports of entry, which also is important. And one thing which I hope is coming into place is the sharing of information and data about this. So we do know where the cases are, and we are able then to get a clear picture of what is happening.
Thank you so much. We've had a question from Christina inquiring about people with autoimmune diseases. Do you think people with autoimmune diseases or diseases and other illnesses in general are more at risk with coronavirus?
About autoimmune diseases specifically, I don't think we have any information, but you would think in principle that they would be at increased risk, particularly if they're on any form of immunosuppression therapy. At the moment, the information we do have is that it's people with conditions like diabetes and cardiovascular disease who seem to be at increased risk of getting severe disease.
Thank you so much. I hope that answered your question there, Christina. That seems to be it in terms of, audience questions. That covered the main topics there. So I just really wanted to thank you, Jimmy, for coming to this session and giving us all of your wisdom and your knowledge and experience in this time, especially because I think, like Toby said, there's a lot of media coverage about this and we're not quite sure all the time, what we should be concerned about and how to deal with it. So you've given us a lot of useful tips here. And the course as well, as you've mentioned, will have a lot of useful tips for us. Is there anything else you wanted to kind of mention about the course or your favorite parts about it that you can tell us?
I think just to say, we've just run the second version of the course, which I think is just coming to an end now, but we do have a plan to do it again in May. So if there are any of you who are interested in participating in that, then we should be running it then. Excellent.
So there's another run of the course coming up, guys. Make sure you sign up to that course. There's links on the event page to the course. So click those links, sign up and secure your place. Jimmy's an educator on that course, so there's lots more to learn from him and more of his colleagues from the London School of Hygiene and Tropical Medicine. Thank you so much, Jimmy, for the session. That's it for today. And goodbye. Thank you, future learners.
Well, thank you, Danielle, and thank you all for your questions and for listening. Thank you.
Thank you.